We need to start getting you ready for bed.
You know, I think I just want to wait for the nurse. I think, but it would be better if I had my medication
Don't call the nurse.
first.
It's time for you to get ready for bed.
I think I need a nurse, and if I think I need a nurse...
You need to stop arguing with me right now. It is time for you to go to bed.
You know, I don't understand why you're treating me this way. This is not...
You know what?
There's
If
nothing
you keep
necessary.
refusing,
It's
then
not
you
necessary.
can wait until the other 15 patients go to bed, and then you can just wait until late at night, and then you can get no help at all, and then sit here in this chair for the rest of the night.
I want the nurse.
In this scenario, the patient is exhibiting the symptoms of defensiveness. You may see behaviors such as arguing, refusing, questioning. In this stage, the patient asks, "Why are you treating me like this? Why are you so mean?" The staff use the incorrect skills of confronting the patient and arguing with the patient instead of allowing the patient to talk. Now we'll look at the scenario in which the staff is using the correct skills.
You know, it's just not fair that I have to be here in the first place, is what I'm trying to say to you. And then, you know, I mean, I don't want to go to bed now. I want to finish my book. I want to get my stuff, and I just don't have my stuff. And I don't know. It's all just too hard. It's too hard, and I just feel uncomfortable. I just feel uncomfortable.
Would it be helpful for you to be able to talk with your nurse about this?
No. No, I don't think so.
Okay.
No.
Well, what I can do now, because we do have some emergencies going on down the hall, I could help you now get into bed, or we can wait for a little bit and then I can come back in a little while to help you. In this scenario, staff gave choices and spoke with the client about their concerns. Also, in the defensiveness stage, other actions you would like to take are distraction, giving choices, and setting limits when unsafe behavior occurs. You're going to bed anyways right now.
Don't touch me. If you touch me...
In this scenario, the patient is in the challenging stage. You may see threatening behavior, threatening of self-harm. The staff use the incorrect skill of continuing to move into the patient, making the patient feel trapped. Now we'll look at a scenario in which the staff is using a correct action.
Forget it. Let's just go ahead. Let's put me to bed now.
Okay, then what I'm going to do is I'm going to go ahead and take your footrests off.
Ow!
In this scenario, the staff member allowed the patient to make choices, gave the patient definition on what they were doing.
Let go of me. Give that back.
In the physical acting out stage, the client is no longer safe. The client is batting at the staff, trying to hurt them. In this situation, the staff acted by not moving out of the way, putting themselves in the place where they would get hurt. Let's look at a scenario in which the staff is using the correct skills.
You know what? Just forget it. I don't think this is a good idea. Why don't you just go get the nurse? I'm hurt now. I need to see a nurse.
Then what I'm going to do is I'm just going to put your wheelchair thing back.
No, I don't want you.
Okay, it's unsafe for me to leave it like this, so I'm just going to take it away.
Just get the nurse.
Okay, I'm going to go get help. In this scenario, the staff used the correct skill of moving out of the way and getting help. If you are ever in this situation, make sure you're watching your space, getting the help, and getting other patients out of the way. Are you better now?
I'm sorry. I didn't mean to start anything. I just was uncomfortable with you taking...
Well, you know, when you hit staff, that's bad. Look at what you did to me.
I'm sorry. I didn't mean to do that. It was just...
Well, next time, you need to watch what you're doing. In this scenario, the patient is in the learning opportunity stage. The patient was embarrassed about what happened, may show remorse, may apologize. The staff showed an incorrect behavior by lecturing the client, making them feel worse, and pointing out what they did and how it was wrong. Let's look at a scenario in which the staff would use the correct actions.
Come in.
Nicole?
Yes.
I got the nurse for you, and she's on her way. In the meantime, I do need to remain in here to make sure that you're safe and you're okay.
Thank you. I'm sorry. Just not feeling like myself. Thanks for staying with me, though. I appreciate it. I'll be fine.
How are you feeling right now? Are you okay?
Yeah, I'm not that hurt. Like I said, I'm just not feeling like myself. Thank you. I appreciate you staying. I'm a little embarrassed. Sorry.
What happened just now?
I was just scared about getting in bed. That's all.
Is it something that we can talk about?
Yeah, maybe, but it's a little too much for me right now.
That's okay. We can talk about it later. Just so you know, you don't need to be embarrassed. But what we'll talk about is we'll talk about what happened and what we can do next time to make sure that things go a little bit differently, okay?
Yeah, thanks for your patience.
Thank you. In this scenario, the staff first asked the patient if they were okay. That is the first thing you want to do, is make sure that there were no injuries to yourself or the patient. The next thing you want to do is talk with the patient. What happened? What can we learn from this? You also, in a situation, if there were other staff involved, make sure that you debrief with the other staff. Make sure everyone is okay. Find out what happened and what can you do to learn from this. Always report any circumstance or situation to your direct supervisor and record according to your individual company's rules. Always wash your hands or wear personal protective equipment during any circumstance. And always remember to report injuries to yourself or to clients to your direct supervisor using your company's individual procedure. Always remember the golden rules of safety. Never be in a closed bedroom with clients without others knowing your whereabouts. Always inform your coworkers of time and place of caregiving. Always know your clients. Always remain calm and never try to play the hero. Next, we will demonstrate for you safe self-defense techniques.